and the basilic vein. This is the median tubital vein. So this is the median tubital vein, and deep to it, this aponeurotic expansion from the lower end of the tendon of the biceps brachii. This is the tendon of biceps brachii, and this expansion going medially and merging with the deep fissure of the forearm. This is the bicipital aponeurosis. So these are the structures in the superficial fissure of the roof, namely cephalic vein, the lateral cutaneous nerve of forearm, basilic vein, and the medial cutaneous nerve of forearm, median tubital vein, and the bicipital aponeurosis. Then there is deep fascia in the roof. The boundaries of cubital fossa, literally, this muscle here, this is the brachioradialis muscle. So a lateral boundary is formed by the medial border of brachioradialis. Medially, the medial boundary is formed by the lateral border of pronator teres muscle. This is the pronator teres muscle. The apex is here, where the brachioradialis and the pronator teres meet. This is the apex. And the base is formed by an imaginary line joining medial epicondyle. This is medial epicondyle and the lateral epicondyle. So this is the base. So base is formed by imaginary line joining medial and lateral epicondyles. The apex is the meeting point of brachioradialis and pronator teres muscles. So this triangular intermuscular interval, this is the cubital fossa. Now in the content of the cubital fossa, we see from medial to lateral side, 1. The median nerve. This is the median nerve, which enters the forearm by passing between the two heads of pronator teres muscle. This is pronator teres, which has superficial head and a deep head. Between the two head passes the median nerve. Lateral to median nerve. This is the brachial artery. The brachial artery is dividing into its two terminal branches, namely radial artery, which goes laterally, and this is the ulnar artery. The radial artery runs downward and laterally, and it is more superficial compared to the ulnar artery. The ulnar artery is a deeper, and it runs deep to the deep head of pronator teres muscle.